Hello, fellow UAMS team members. I'm Dr. Bob Hopkins, Chief of General Internal Medicine in the College of Medicine. In addition to my UAMS roles, I contribute to national and local efforts to improve vaccines and vaccination. I want to take a few minutes to talk to you about COVID-19 vaccines. I've heard a number of concerns and misconceptions about these vaccines, and I want you to know what we do and don't know based on science, current vaccine studies, and I also want to assure you that there's a robust plan in place to actively monitor the impact and potential side effects of these vaccines. Many are concerned about the speed with which we've developed COVID vaccines. Much of this speed is as a result of three factors: scientific advances resulting from efforts to develop other coronavirus vaccines, massive investment by the government and by industry, and by some of the steps in vaccine development process being done in parallel instead of one after the other, as has been done in the past. Most important, no steps were skipped. All of the critical steps to assess safety and the benefits of these vaccines have occurred, and ongoing evaluation of safety and efficacy will continue as we start using these vaccines. This is the period most vaccine scientists call Phase 4 study. These first vaccines will reach us following a very detailed review of the studies by scientists both within and outside the government, who've recommended their approval for use under a process called Emergency Use Authorization, or EUA. This EUA allows us to vaccinate and protect Americans from COVID until there's enough information and follow-up for the Food and Drug Administration to consider full vaccine licensure. The vaccines we'll first have available are messenger RNA vaccines, and I'll focus my brief comments on that type of vaccine. There are a number of other vaccine types being developed, and clinical trials for over 100 other COVID vaccines are underway. The messenger RNA vaccines must be stored frozen. They have to be thawed and mixed with sterile saline before use. The vaccines must be given within a couple of hours of this process. Our current focus will be to vaccinate UAMS employees who provide direct care to COVID patients and to support the care of patients with COVID. You who join me in doing this work are at highest risk for exposure and for COVID disease. PPE can only protect us when it's being used. We need to be vaccinated as soon as possible to give us a layer of protection beyond PPE to keep us safe so we can care for our patients. Very soon, others will begin vaccinating patients and staff in long-term care facilities in the effort to protect these patients who are at highest risk of acquiring and dying from COVID disease. Once these two highest priority groups are vaccinated, our efforts will turn to immunization of other healthcare workers, those who provide critical services in our communities, and other individuals in the community in waves as more vaccine becomes available. We will provide updates as this occurs. The current vaccines have not been extensively studied in people with severe immune system problems due to disease or treatment, but there's not a concern about vaccine safety in these individuals, only a concern that the vaccine may not be as effective, and these individuals should be vaccinated. We do not yet have enough information on these vaccines to recommend their use in children under age 16. Until we have these data, we shouldn't vaccinate people in those groups. At the time you're vaccinated, you will receive a number of pieces of information. First will be information about the vaccine as required for any vaccine being used under the FDA EUA process. Second, an immunization card noting the vaccine and as a reminder for your planned second dose in about 21 days. Third will be information about vSafe. vSafe is a program developed by CDC to monitor for any signs and symptoms which may occur after vaccination. After you sign up, you'll receive text messages with a link to a web survey, which should be completed to help us monitor the safety of these vaccines, and those surveys will continue to come over time. Persons with concerning survey responses will get a call from CDC vSafe staff. I would strongly encourage all who are vaccinated to participate in vSafe. Many patients who received COVID mRNA vaccines in the studies had pain at the vaccine injection site, fever, muscle aches, headache, and fatigue and malaise. This can occur after either dose, but was much more frequent after the second dose and usually lasted only about a day. I would expect some of us to have similar symptoms after vaccination. Well, those immunized may develop some degree of protection from the vaccine by 2 weeks after the first dose, but you'll need to receive 2 doses to be able to expect the high levels of protected reported in the press. At this point, we really don't know how long these vaccines are going to be effective. That's something that's going to be monitored actively in those that are in the trials, but also as we start vaccinating people more widely through the emergency use authorization. So we will get better information over time. But what we do know is that some of the levels of antibodies, our body's tools that we use to fight infection, levels of antibodies in these trials appear to be higher than people even that had severe coronavirus disease. So that's a good indicator that it's likely to be durable protection. But whether that protection is going to be months, whether it's going to be years, whether it's going to be decades or lifetime, we really don't have enough information to answer that yet. We all know that the coronavirus has had an increased impact in communities of color. We've seen reports about increased rates of hospitalization, increased rates of death, increased rates of severe disease. There have been historical and ongoing difficulties with disparities in care to communities of color. To help address this, the FDA has insisted that the companies that are doing trials of these vaccines include populations that are representative of the diversity in our country. And in the data that's been presented so far, there's no signal that there's any difference in safety or effectiveness in people of color as opposed to those that are not of color. There doesn't seem to be differences in people that were evaluated in different areas. And in my view, vaccinating widely, effectively vaccinating across our entire population, is at least one step that we can work on trying to resolve some of those historical disparities in health care for communities of color. We cannot let our guard down. Vaccination takes time to help develop protection. And we need to have enough people in our community vaccinated for the vaccination to provide community protection. So it is absolutely important that we continue to wear our masks anytime we're outside of our homes or if we're in our homes and sick. We need to continue to socially distance. We need to continue to wash our hands. We need to continue to stay away from crowded settings because now is not the time to let off those pressures, those public health measures that are there to help protect us. We need to double down on them. We need to do even more of those as we start vaccinating because that's going to get us that much closer to that time when we can back off on some of those things, when we've got a large proportion of our population vaccinated. I want to thank all of you for what you do to care for each other and for the health of our fellow Arkansans. Join me in taking the COVID-19 vaccine as one more component of our efforts to defeat this virus pandemic. And please, continue to practice social distancing. Wear your masks and wash your hands. We are all in this together, and we will come out of this COVID pandemic stronger as a community.